My name is Michelle Miller, and my son Parker has Niemann-Pick, and we live with my husband Dane and Parker's older brother Roman in Mesa, Arizona. Our Parker is a child that smiles all the time and is full of energy. He is currently 2 years old and loves dinosaurs, and he wants to do everything his brother does, even if that means to stir up trouble. We have been fortunate that he has not shown any neurological symptoms related to Niemann-Pick as of right now. Parker was born on time, but within 1 month of life, his belly became significantly distended, and he struggled to breastfeed. He was slightly jaundiced, but we were told it was likely breast milk jaundice because ultrasound results came back normal. Over the next couple of months, as we watched him grow, Dane and I became more worried because his stomach remained large, he seemed to have more GI symptoms, and it almost seemed to hurt him to breathe. We took him to a GI specialist at 4 months of age and was told that he had a large liver and spleen, which was a shock to us. Parker was hospitalized for 4 days so he could undergo a full workup of medical tests, including a liver biopsy. Everything fell apart for our family a month later when his hepatologist told us Parker would need a liver transplant, and we found out that all of his liver issues were due to Niemann-Pick Type C. After speaking with several of his doctors, we chose to pursue an experimental IV infusion for Parker since it was not guaranteed that he would even be able to receive a liver since NPC is such a severe neurological disease. At 7 months old, Parker had a chest port implanted that allowed him to receive infusions every 2 weeks, and this IV medication has improved his liver immensely and made it so that both the size of his liver and spleen has decreased to almost normal. Although his infusions are helping, he cries and runs away as soon as he sees me get out the tube of lidocaine cream because he knows what's coming. On his infusion days, the nursing staff just adore him, and they shower him with more attention than really anyone deserves. But he still dreads and remembers what comes each time we go to the hospital. On these days, we are at the hospital for 10 hours, and this really wears on Parker as well as my husband and I. He is disappointed that he does not get to play with Roro, which he refers to Roman as, because he idolizes his brother, and that's his favorite person to play with. I look back at Parker's baby pictures and see how sick he really looked. It is hard to comprehend that this is the same child based on how well he is thriving right now. NPC is a horrific disease, and my husband and I remain vigilant as we wait for any neurological symptom to appear, which is inevitable. I worry about how I'm going to answer him when he asks why he can't do the same things that Roman and his friends can do. We are hopeful that treatments become available that not only prolong his life for us, but also that allow a good quality of life for him. We want him to be able to fully embrace his childhood, even though it's guaranteed he's going to have to make sacrifices.